Medial meniscus root tear repair with the novel technique with the help of root fix anchor. Make a medial accessory portal vis. Aneromedial to the tibial tunnel. Debride of tibial cartilage with meniscus curette. Prepare the bed through exposure to subchondral bone. The subchondral bone refers to the biological bed for healing, with the help of meniscus curette. Now place Osteocare multi-use root repair zig. Then, drill a tibial tunnel with a 2.3 mm drill bit. And then, place the cannulated sleeve in the tunnel through the angled bullet of the zig. Cannulated sleeve is placed for the Osteocare crosswire. Pass loop and fiber through suture shuttle devices. Pass introducer fiber through the tibial tunnel. Withdraw introducer fiber from the accessory medial portal with the help of a loop and fiber. Anchor with Osteocare root fix anchor in a retrograde manner. As the root fix anchor is installed in the root, which is 3 to 4 mm, pull the strands to check pull-out strength. Direct the first fiber strand with the suture passer through the detached meniscus. The accompanying fiber is passed into the meniscus stump. The same step is repeated with the second fiber. At this stage, the reduction is attempted by reducing the root to the native position. Now, both the fibers are tied over the meniscus. The final knots are locked using the knot pusher. The medial meniscus root is fastened to its tibial bed. Finally, cut the 0 number fiber with Osteocare CV form suture cutter, leaving a low-profile knot over the meniscus. This technique has many advantages. The fixation is quite robust, being in close proximity to the root avulsion. Further, chance of tunnel collision as there is in the traditional technique. Hence, it is apt for multi-ligament surgeries. This technique even helps in preventing the occurrence of osteoarthritis in patients.